మీరు మాట్లాడి మీరు వస్తున్నారు కదా సార్ మీరు అక్కడ వస్తున్నారా
హలో జయ గురుదత్త హలో గౌతమ్ సార్ హలో 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 హలో
మైక్రోఫోన్ పనిచేస్తుందా వస్తుందా స్ట్రక్ అయింది ఇన్పుట్ లేదా ఇన్పుట్ పెట్టలే
ఏం కావాలి అమ్మ సుజాత అర్జెంట్ గా బాత్రూమ్
కొంచెం వచ్చింది
Yeah. अच्छा तो मेरे बाद ग्रे ड्रेस वापस करना पहले वाला। कौन सा मिंत्रा फ्लिपकार्ट? वो जो सेम था ना दो। हाँ वो मिंत्रा का वापस करना, फ्लिपकार्ट का वापस। पहले वाला कौन सा था? मिंत्रा। हाँ वो वापस। ये बताओ करो। मिंत्रा का वापस किया। हाँ वो रखना मैं करती हूँ। हाँ हाँ अच्छा हाँ अच्छा है ये ज्यादा अच्छा ज्यादा अच्छा नहीं तो ब्लैक स्टोन में है ना अच्छा है ना आवाज ही नहीं है
ये बोल रहा
हर्षद बेबी है
हो ना कोणती
कुठली बेबी आहे सांग ना
हर्षिता बेबी असताना शिव असताना पण थांब तरी तुला मला माहिती आहे हे बघा ते हे कोण बाजूला ते कोण रुचिरा अरे तसं नाही असं ए पूजा होती की घरी दादाच्या लग्नाच्या नंतर
सेम प्रश्न हाँ अभी रस्सी नहीं जरे दे दो आपको रिसेप्शन के बाद फिर ले लो
Introduction. Now I would like to welcome Dr. Durga Prasad Rao sir, the General Secretary HMAT, to speak a few words and to introduce the sponsors. Please.
Good evening, everyone. Respected Chairperson, our advisor, Dr. Vashisht sir, and today's special guest, Shri Surendra Luniya sir, and other trustee, Shri Vijay Kale, and our beloved speaker, Navin Pawaskar sir, and distinguished guest, Suman Chand Jain, and Deepen Shah, doctors, friends, all my members. And today's guest of honor, Dr.Amarender Reddy, my classmate. I once again welcome you all. At the outset, this is a festive moment. 112th birthday anniversary of Sri Dhage. throughout India, having a permanent infrastructure, permanent building, and carrying several activities without break. Besides regular OP on all days, including Sunday, mornings and evenings, the certain specialties on different systems on scheduled dates are being included. And all these systems are rendered by our honorary physicians who come freely and serve the patients here. All these specialty consultants and the duty doctors and the consulting physicians are honorary physicians here. Not only consultation services, we also train and guide the house physicians, senior doctors on their skill set clinical side. But the dire need of present situation is hospitalization in homeopathy, which is an in India. So we don't have much infrastructure hospitalization in homeopathy, homeopathic type of treatment. And except the government teaching hospitals, 1 or 2 on the hands, we have no other hospitals. Though the homeopathy is capable of tackling emergency conditions, acute cases, terminal cases, we are lacking the infrastructure and other facilities like casualty, patient, and intensive care unit. Of course, we are capable of treating gynec and obstetric cases, maternity cases, and pediatric cases, traumas, injuries, bites and burns, and several other accidents. But due to lack of homeopathic hospitals, we are forced to shift the patients to other hospitals and corporate hospitals. This is my, from this dais, this is my earnest request to our special guest, Shri Surendra Luniya ji. Sir, as you are thoroughly experienced in maintaining the hospital like Mahavir Hospital for many years, please think about the hospitalization in homeopathy, an exclusive homeopathic hospital with all facilities and totally homeopathic treatment, where we can handle so many cases on easy methods and cost effective. At the same time, we are not against any other system of medicine or any type of treatment. Wherever, whenever they are needed, so the medicine goes in an integrated approach. So one of the senior doctors was saying, whichever may be the pathy, whether it is allopathy, homeopathy, isopathy, or some other pathy, the doctor should have the patients to see the patient in a right manner and perfect manner. Then only the doctor's system will improve. Now, this is the time to introduce our sponsors, Sri Vijay Dhage Ancestral Trust, who have been associating with us since last 25 years in conducting the memorial oration on Amma's name. We sincerely thank the management and trustees for their generous contribution and support. Vijay Dhage memorial oration at our of Telangana was by Vijay Dhage Ancestral Trust in the year of 1997. It was founded by the just under the aegis of Hyderabad Children's Society and running 3 homes: Radha Kishan House for Infants, Radha Kishan House for Small Boys, Radha Kishan Balika Bhavan. Even a happy, healthy, and comfortable and secure child developed in mother's love. Several inmates of these homes have become graduates, lawyers, doctors, nurses, and businessmen. Also perform marriages to the eligible girls finding a suitable groom. And Dhage had vowed to look the neglected children of the society and promised not to have any children of their own. That is the greatness of their couple. They want the children and they thought that the in the society are their own children. That is the greatness of the Amma Dhage, Srimati Dhage, and Venkata Ji Dhage. The present management under the able secretaryship of Mr. Dinu carries on the noble ideas of Dhages. The trust out of its meager income helps poor people in various ways like fee for poor students, for further studies, performing marriages on poor families, and some deserving poor are also helped in medical and surgical treatments and other various conditions. The Dhages have been the recipients of many national and international awards. The homes were visited and appreciated by many great men like Dr. Sarvepalli Radhakrishnan, Dr. Babu Rajendra Prasad, Sri Lal Bahadur Shastri, Dr. Shankar Dayal Sharma, and many other dignitaries had walked on the premises of this Temple of Selfless Service, the Shri Vijay Dhage Ancestral Trust. So today, on behalf of the Shri Vijay Dhage Trust, our guest Luniya ji has handed over the 15,000 check for conducting this oration. Thank you, sir. Thank you so much for you and all the trustees. Okay. Thank you. Thank you for your patient hearing.
Thank you, Dr. Durga Prasad Rao, sir. Now I would request Dr. Vijay, sir, speak a few words and address the audience. Welcome, sir.
I am associated with Vijay Dhage Ancestral Trust from 1985 onwards. Mrs. Navin Dhage also was closely known to me. They were such a noble souls on this earth. They have gifted away entire benefit of the trust. And their society is running a children's home where about 100 people are being provided with food, shelter, and education. Great cause they are serving. Mr. was the Rajya Sabha MP and a chartered accountant himself. He was the leading chartered accountant in the 60s. And Mrs. Dhage, after gifting away property, then she did not have a home to live. Then we had constructed a portion in our trust premises. I had to live This for medical college. I have personally handed over her body to Gandhi Medical College for research purposes. So very rarely we find such persons. I'm also glad to know that you are continuing this memorial oration for 25th year. I wish all the success to you and grand success will be there.
So now next, let us move on to the felicitation. I would like to
take him meetings. Shri, come here, Baba. Hey. Alar ka sabab mera. अस्तर में हाँ
Hello, Ashwini ji, Sunita ji, Krishna ji. Please keep your mics in mute, please.
And Dr. Kiran, sir.
Ashwini ji, Sunita ji, Mirial Krishnaya. Keep your mics mute.
And I would request Dr. Venugopal Gouri, sir, for introducing the special guest. Dr. Venugopal Gouri, sir, introducing.
A very good evening to the presiding officer of this evening, Dr. Shri, Secretary of our association, Dr. Prasad, honored guest of this evening, Shri Surendra Luniya, another important guest of the evening, Shri Suman Jain, Shri Vijay Kale, our speaker, Dr. Navin Pawaskar. A very good evening to you, sir. Warm welcome to all the delegates of this evening. And we also recognize the presence of our Vice Presidents, Dr. Manik Prabhu, Dr. C.V. Swami, and the stellar practitioners of the Twin Cities, Dr. Navin Reddy.P, Dr. Shekhar Reddy, another guest of our evening, Dr.Amarender Reddy.P, who has achieved great heights in the state of Telangana in our field of homeopathy, and all other delegates, Deepesh Shaji. A warm welcome to one and all. We are richer this evening because we have an important gentleman who has been in the aid of medical profession. A person, it's not just a doctor, it's not just a nurse or whoever has a medical knowledge that actually can do some service for the benefit of mankind in treatment of disease. Shri Surendra Luniya now receiving the memento from our Secretary, Dr.Durga Prasad. For any disease to be cured, it is not just the doctor or the medicine. It is also the goodwill, the good compassion, and the great heart of society in general, and few good men like Dr. Shri Surendra Luniya in particular, who can be of great help to the society. He has been in the philanthropic world for all his life. He's been a socialist, he's been a reformer, he's been a hard working gentleman right from the grassroots, reaching out to the people, the importance of health, importance of good education, hygiene, and he's been on the service societies list for altogether for more than 6 decades of his life. Is the Jain Relief Foundation, whether it is the Bharatiya Seva Sangh and many other activities, irrespective of caste, creed, or religion, is to take care of it all. One amongst the major achievements of him are being the chairman of Mahavir Hospital, where he saw to it that the hospital grew to great heights. They have a great new building. They have greater infrastructure today than ever before. And thanks to Luniya ji, this was the first time ever in a super specialty hospital in Hyderabad. We had a homeopathic outpatient department from 2014 onwards, where our homeopaths have been manning the place, and we look forward to seeing that we increase our activities there. And he's also an important trustee in many places like the Dhage Trust, and he's been kind to us to give us an importance and role, having seen that Srimati Bai Dhage Memorial Donation has been achieved and conducted for more than 25 times, or the 25th time this day that we are covering. So he recognizes that homeopaths are committed health professionals, and he wants to give a new lease of life to us. And we really appreciate you, sir, for doing this. Another important trustee of this evening, Dr. Vijay Kalaji, also has been in the same mode. Shri Surendra Luniya ji, as we know, is a great Gandhian, a Sarvodaya, a disciple, and he has received several awards nationally and internationally. And one of the best among was the Jain Ratna Award from the Jain Seva Sangh that he received from the hands of Shri Chandrababu Naidu ji, the former Chief Minister of the United Andhra Pradesh. And he's also received the Scroll of Honor, a Lifetime Achievement Award for the pioneering works for the serving the poor and the needy, by being the president of the Lions Club International. And he's also been the role of honors for being a committed lion. And as we all know, he's been associated with various organizations. Thank you, sir, for being here. We really appreciate you, and we look forward to working with you under your guidance and also your blessings. So thank you so much. Homeopathic Medical Association of Telangana also recognizes the presence of various homeopaths who are watching this online. Dr. S.S. Patil, Principal of Gulbarga Homeopathic Medical College. We have Dr. M. N. Chariji, a senior homeopath and doing service at Hamsa Homeopathic Medical College here. And whether also all the friends of homeopathy who are here. Thank you so much.
On behalf of Homeopathic Medical Association of Telangana, we are presenting a small gift and a token of love to the trust. The support that they have been showing to us. Next, I would request Dr.Amarender Reddy to please. I would request Shri Surendra Luniya ji talk a few words.
Namaskar. I'm Luniya, Trustee of the Trust. I'm very friend Mr. Kale. He's also trustee there, and we are having institution run by Mr. Dhage. It will trust as well as by the trust created by Mr. Dhage and Mr. Tamina. As we know, we are celebrating the birthday of Tamina by Dhage Amma, who is now no more. They have decided while doing their marriage that they will not make any children. They will not have any children. And they were without children whole of their life. And the homes which they were Radha Krishna home, very famous home for rescue children. Girls home is there, boys home is there. Altogether about 300 inmates which they were with their own these trust. The lady, Mrs. Tamamet, had left us before 10 years. This real body charitable trust also on behalf of that we are contributing to today also we have given 15,000 rupees to this Modi charitable trust, as well as I will also give personally from myself 5,000 rupees for I think in a very small way, but with a great respectful way, you are attending service of homeopathic here, and your doctor. Durga Prasad is also doing his development stuff. But chairman who has also
అక్క అందరం కలిసి బయటికి వెళ్ళి డిన్నర్ చేసి వద్దాము. వాళ్ళ ఇంటి దగ్గర అడుగుతుంది నాకేమో నేను 99% రాము అని
on behalf of the trust, I assure that any help you need will be rendered by our trust and the
అడిగి చెప్తా 99% రామే అని చెప్తున్నా.
come and take time for institution also. This is what I thank
వాళ్ళకి చెప్తే మనకు ఫస్ట్ చెప్పింది వాళ్ళని బట్టి ప్లాన్ చేస్తాం.
గౌజన్య గారు మీ మైక్ మ్యూట్ లో పెట్టండి ప్లీజ్.
ఇంకా 2 hours తర్వాత 7-8 మళ్ళీ ఆడుకోవాలి.
transfer, etc.
సౌండ్ వస్తలేదు ఏమొత్తారా ఇందాక ఫోన్ వచ్చింది ఫోన్ వచ్చి మళ్ళీ కట్టేది
We acknowledge the presence of all documents, Dr. Reddy, Dr. Amarender Reddy, Dr. C.V. Swami, Dr. M.N. Chari, and myself. We are all documents. Dr. Madi Prabhu, our Vice President, is congratulating Dr. Amarender Reddy. And we acknowledge the presence of senior homeopathic doctor, famous Dr. Varanasi and Mahesh Bagdala garu, and our Gen.Secretary Anand and Satish Krishna, Dr. Satish Krishna. I request Dr. Rajeshri Madam, our technical advisor, just to join us and our friend Dr. Amarender Reddy, practicing at Siddipet and Hyderabad. And he is the first person to be nominated by Telangana government as the member of State Council of Indian Medicine and member of State Council of Clinical Establishment Act. We are very proud to have his nomination, and he will be in the position for another 3 years. So we are very happy and we are very fortunate, and our friend has got this chance as a member of this Telangana government. And now I am Dr. Navin, the professor, retired professor of KSPS College, and our classmate, senior practitioner of NCDC, is felicitating Dr. Amarender Reddy.
Request Dr. Gautam to introduce the guest of honor.
Since the year 1985 at Siddipet, served as a president to Lions Club of Siddipet during the year 2002 to 2003. And during this tenure, he has performed more than 100 service activities, which includes 18 eye camps, 5 mega health camps, 6 blood donation camps, and many more activities. Was assessed as the best president at the regional and state level for outstanding contributions to the society and organization. So it's our pleasure to felicitate Dr. Amarender Reddy Garu at our association, and it's my pleasure to say a few words about it. Thank you for giving this opportunity.
Esteemed members of Homeopathic Medical Association of Telangana and ICRA, and distinguished fellow members of the medical fraternity. Thank you all for the kindness and goodwill shown towards me. Today's felicitation to me is a recognition to my long service and commitment to the profession. It will strengthen my resolve to serve all sections of the society and cater to their healthcare needs to the best of my capacity by making full and efficient use of all available resources. Lastly, I am thankful to the state government, particularly to our Honorable Health Minister Sri for appointing me to these two coveted bodies. I will discharge my responsibilities with due care and diligence. Thank you very much. Namaste.
Thank you so much for Dr. Amarender Reddy. For with a short notice, within 4 days, he could able to take the time and meet us here on our request. This is our great proud to felicitate him on behalf of Homeopathic Medical Association of Telangana. Thank you, Dr.Amarender Reddy. Thank you all. And thanks to my classmates also who have enthusiastically joined us to felicitate Amarender Reddy. Thank you all.
Now I would request Dr. Anand to please come on the dais and present a vote of thanks to this celebration program.
On behalf of Homeopathic Medical Association of Telangana, the office bearers and executive committee members profusely thank all the doctors and all the participants for today's Dhage oration. We profusely thank Shri Surendra, Luniya, former chairman of Mahavir Hospital, grace this occasion. We also profusely thank Shri Jain, Shri Vijay Kale, Trustee of Dhage Trust. We profusely thank Dr.Navin Reddy.P and Dr. Navin Pawaskar, who was the speaker of today's evening. We profusely thank the Dhage Trust, which is conducting today's 25th oration. And this trust conducts in the month of June every year. We also profusely thank Dr. Vashisht, who presided today's meeting, and the galaxy of doctors, including Dr. Mengji, Dr. Venugopal Gouri, Dr. C.V. Swami, Dr. Shekhar Reddy, Dr. Kiran, and all the other doctors by name. So thank you very much, and we shall stand for our national anthem.
1 minute. Just before prayer, yes, I would like to hand over this special memento to Shri Surendra Mishra ji, the senior managing trustee of the Shri V.K. Dhage Trust. Now at present, sir is out of country. He could not attend. So that's why on behalf of Homeopathic Medical Association of Telangana, we are handovering the memento on Surendra Mishra ji's name.
The national anthem will be after the session. Thank you.
Now I would request Dr. Navin to come on the dais and give a brief introduction to our speaker, Dr. Navin Pawaskar. Respected dignitaries on the dais, teachers, and my fellow colleagues in the audience. I am Dr. Navin here to introduce Dr. Navin Pawaskar, sir. It gives me immense pleasure to do so, especially off campus. Navin Pawaskar, sir, a healthcare consultant, brings to the table vast and diverse experience from healthcare arena. Basically a postgraduate doctor, hospital-based clinician for more than 25 years in the tertiary healthcare with identical teaching experience. He has risen from the rank to serve as Director of Hospital Services, thus rallying a significant administrative experience. After his stint of 2 decades accumulating experience in clinical, administrative, and education field, he completed his master's in healthcare from the reputed university in the United States of America, with a major in healthcare finance. He has experience of associating in the National Healthcare Organization, has worked on research projects, published several articles, and authorized a book. He has been instrumental in conceptualizing, planning, and the execution of integrated holistic care model in patient care and academia. With this, I would like to call upon Dr. Navin Pawaskar, sir, to begin our much-awaited session for today. Thank you.
ఇది ఉండాలి ఇటు సైడ్ ఉండాలి బస్ సార్
ఆడియో ఆన్ చేయండి.
Yes, sir.
Good evening to all. At the outset, I would like to thank Homeopathic Medical Association of Telangana, HMAT, and Institute of Clinical Research in Homeopathy, ICRH, for inviting me to give this memorial oration on the 25th memorial oration of Amma, Srimati Dhage. I have been witnessing this felicitation, and I feel honored and to be here present along with such dignitaries who have contributed to the growth of HMAT and homeopathy. Well, I think Dr. Durga Prasad Rao should be credited for getting me here on the dais. To say the least, he chased me like somebody would chase a rabbit out of the to come out over here. Fortunately or unfortunately, I had to travel a couple of times and I had to ask him to give me another date. But I think I should salute his enthusiasm for just chasing me out and making sure that I'm around here on this particular day. So thank you all. Thank you, Dr. Durga Prasad Rao, for chasing me out over here and bringing me here. Well, I think I've chosen a topic which I thought is very, very practical for all of us. This whole experience that I'm going to share now is very simple. Many of us have practically used it in our day-to-day practice. But what is important probably is to understand what we are doing and why we are taking certain actions. So from that perspective, I will be talking now on homeopathic approach in injury and healing. So healing is not a science, but an intuitive art of moving the nature. So essentially, when you want your body to heal from any kind of an insult, It's essentially, it's a particular way of moving your natural resources to allow your body to heal. So being minimalistic is important. We don't need to be aggressively involved in our body to heal itself. We should allow the nature to take the course and allow our healing process to get completed. This is what is the whole purpose of this particular lecture. So healing is not a science, but it's an intuitive art of moving the nature. So allowing the nature to take over your body when it's in the process of healing is very, very important. Now, from a science perspective, wound healing is a natural restorative response to a tissue injury. Healing is the interaction of complex cascades of cellular events that regenerate, surfacing, reconstitution, and restoration of tensile strength of the injured tissue. So if you can see, there is a distinctive difference when you say something is an art and something is a science. So when we talk very specific things about related to the cellular events, it essentially tells you that it is about regenerating, resurfacing, reconstituting, and restoring the tensile strength of the injured tissue. And to make it very natural is what a homeopathic doctor should be inclined to do. That is his objective. Now, injuries happen because of falls, accident, blows, sprains, burns, foreign bodies, stabbing, cuts, surgical, post-surgical sharp and blunt instruments, and as small as a shoe bite, animal bite, or an insect bite. Now, just to revise, I'm sure many of you know this, but I'm just recapitulating everything. Type of injuries can cause are internal and external, and then can cause bleeding, extravasation, contusion, concussions, wounds, aberrations, lacerated surfaces, corrugated wounds, hemorrhagic, and ulcerations. So this is all that a normal injury leads to. More important, I think everybody knows these remedies: belladonna, bryonia, heparin. So there's nothing new that I'm talking about over here. But more important is to understand how to use them, when to use them, how much to use them, and for how long to use them, and what are the parameters that help us understand whether the patient who is on a homeopathic healing process after an injury is doing well or not. Most of these experiences that I'm talking about are from the hospitals that I worked. I have been hospital-based since 1994. 95, I was in the first hospital, and since then I've been hospital-based. We run a small unit in Yashoda called Ariv. So we are part of the Yashoda hospital team as well. So I've worked at all the levels and understood how hospitals work, how patients in hospital need to be catered to, and what are the different things and needs and necessities of a hospital-based homeopathy. So whenever there is an injury and healing, the first four things that you really need to understand is hemostasis, inflammatory phase of healing, the proliferative phase of healing, and the maturation phase of healing. The tissue goes through four distinct phases: hemostasis, inflammation, proliferation, and maturation. And these stages of healing, there is a phase of injury, which is an acute injury phase. Then comes the acute inflammatory phase. Then comes the repair and regeneration phase. And then comes the tissue remodeling phase. And homeopathy has a role in all these four phases of injury and healing. You can classify injuries by regional and tissue injuries. This is just to have a recap. There are head injuries, eye injuries, and based on the tissues and regions. And you can also understand injuries based on the type of pain that your patient is expressing. Bruise, aching, burning, throbbing, neuralgics, and stings. And these are common remedies of injuries that I think everybody knows about them: arnica, Melisper, calendula, camphora. So if you ask me if there is any new remedy that I'm going to talk about, not really. But I would be rather speaking on how do we practically use this remedy, what potencies we use, and how do we how long do we use these remedies in a healing process. For burns, I think Epis, belladonna, cantheris, echinacea, arsenic, I might have left out a few remedies, but it's just a recap for us to go through till we warm up on this particular process. Now, what does our organon say when we talk about it? There are a few references in organon which help us understand how to treat trauma, injury. So, Samuel Hahnemann describes this as state of disruption of constitutional states by accidents, emotions, acute disorders, or miasm. Injury can be considered as an acute disease condition. Considering a similar symptom syndrome of such acute states, the physician has to carefully look into investigatable symptoms, peculiarities of this disease, and more for acute individualization. So I think the advice from the master is very clear that we have to follow the process of individualization in order to treat this acute disruption of a constitutional state that happens because of trauma. So it is easier said and done, as we always know. So when I'm starting off with very, very simpler clinical experiences, which I'm sure everybody would appreciate that we all have done this in our clinics. And then we go into building a standard way of approaching the homeopathic process of healing. I think this is something that we should understand, that when we take a decision, homeopathic decision in injuries, there are 6 things which you see on in the vertical column: time scale, how acute is the injury, when has the patient reported to you, what are the tissues involved in the injury, what is the stage of injury. By that I mean whether it is in the hemostatic phase, whether it is in the acute inflammatory phase, whether it is into repair and regeneration, or whether it is into remodeling phase. You should also focus on to find out whether the wound is contaminated or infected. What are the affinities, that is the tissues around it, and when we select a remedy, to find out what is the primary and secondary action of that particular remedy and the characteristics. So we will be, hence whatever we are going to discuss now is based on this particular framework that we are talking about. So we come to a first case, which is of a 50-year-old lady who fell from a chair, mind you, 6 days ago, and injured upper 1/3 of her right tibia. She developed pain, swelling, which was around 33 centimeters diameter, and continued swelling, in size. And 3 days later, she got fever for a short period. So this is how she presented to us. So she came essentially with followed by a swelling on the right tibia. So we took an orthopedician was there, and he said there is no fracture, but there is a big hematoma on the right tibia, and that hematoma seems to be secondarily infected. So this is precisely what I am trying to say in this particular table. The time scale is 6 days. So the patient presents to you not immediately, but after 6 days. It is essentially the subcutaneous and the fascia that is involved. And the thing is that it is already, the hemostatic phase is over. There is secondary infection and there is inflammation around in this. So now, what is our objective in treating this particular case? What are we trying to achieve in this particular? One most important thing is to prevent the infection from spreading, and second important thing is to resolving that hematoma. Right? We are not trying to stop the bleeding now. The bleeding has already occurred. The hematoma is already formed and it's encapsulated. So this is what I'm trying to draw your attention. What is your goal? What is it that you are trying to treat in this particular patient? What is it that you are trying to achieve in this particular? If you recall aphorism 3, this is precisely what they talk about. You have to know what exactly you are treating in the case, and you have to know what remedies you are going to use and why you are going to use that. So your objective of the treatment has to be clear on day 1 before you start the treatment. So I think remedy selection is not a big issue. It's an injury, ailment from injury. And the pathology is that of a bleeding and formation of hematoma. So I think there is no no great points for guessing the remedy. Now, what is important is patient had very low grade fever, which is normally what happens in a case of hematoma. This is a known phenomena to happen because there is inflammatory process. So it is not an infective fever, it's an inflammatory fever. So you will get around 9900 patients touching that level. Important thing to know is, apart from that hematoma, patient had no other symptoms apart from some general pain that she was talking. So I don't have to tell you that we prescribed arnica, but most important thing is to understand what in the arnica that we were trying to look for at this point. So arnica can be used immediately after fall as well when there is acute bleeding, and arnica is used even to resolve the hematoma. So how does this happen? Because these actions of arnica are contradictory to each other. It is known to be hemostatic and it is also known to resolve the hematoma. How does this two things happen in arnica? And what potencies will allow you to use which particular kind of action of arnica? That is the question that we have. So arnica has a constituent called artemisinin. Okay, it's a flavonoid and a carotenoid, which has an anti-inflammatory and an antioxidant activity. It has a local stimulant action and promotes granulation and has antiseptic properties because of artemisinin. This is not the chemical which causes hemostasis. It acts as a local stimulant, promotes granulation and prevents antiseptic. So this is one of the components of arnica. The reason why I am discussing all this is we would prescribe arnica, we would know, everybody knows that it would heal. But why in this particular case is it healed and in what potency? So when you want to use this kind of a process where the symptoms are very minimal, the patient has come after 6, 7, 8 days, the pathology has already formed up, right? Do not go for high potencies. Start using the lower potencies. Because essentially, as I discuss this concept in the next few cases, you will probably understand what I'm trying to say. So we used arnica in 30C potency over here. Because essentially you are trying to assess low grade inflammation. The patient has no other characteristic, individualizing characteristic, except the presenting feature is the pathology of it. Now, why would you not use 1 ml?
Sarita?
And when would you use that? Is a question that you can keep it aside.
Sorry, doctor, please
Look at the chart that I have
lesson is going on.
The patient is coming to you late after an injury. By late, I don't mean by late, I mean after the pathology post-injury has already formed, right? And there are no characteristic symptoms available except the pathology. That is the time to use the lower potencies of these remedies and extract the active principles of artemisinin and other things to come into picture. So we used arnica, and why do we use arnica? Because this is the pathophysiological action of arnica that is mentioned in our books. Arnica is known to have immunostimulant action. It in fact shows to have an action of stimulate WBCs in animal studies. So this is something which has not reached our books, but if you read the research papers, you will find that artemisinin is capable of doing this kind of activities. What does the bird say? The bird says arnica arrests the secretory powers of capillaries and produces similar states to contusion. What Farrington says is the same thing on the blood vessel. Mark what Clark has to say. Trauma is in all its varieties. Effects of remote and recent, arnica is useful. What does the Fraser say? They all talk about subcutaneous bleeding, vessels action on capillaries, ability of the arnica to stop the secretory power of the capillaries and bring about the absorptive power. I think if you read in depth about these materia medicas, this is where you get these ideas of why do we use certain kind of remedies in certain potencies after this. So arnica 30 QDS was prescribed. The main issue was that it was an old injury, 6 days old, wanted the hematoma to resolve and not get infected. Within 3 days of starting Arnica 30, the swelling subsided and became around 30 to 40% less. And on by 5th to 7th day, the entire swelling and the inflammatory signs were gone. And that is the time we went and to prescribe the next potency. Now, on the 10th day, we again took an opinion from the orthopedic surgeon, and he clearly mentioned that there is a complete fibrosis of that particular hematoma now, and that there is no need to treat this case further because the objective of resolving the hematoma and preventing the secondary infection and healing has been achieved. Mind you, we have been asking the orthopedic physician to follow the case. I think this is one of the best way to educate our colleagues in modern medicine, is to demonstrate them in the cases side by side when you are treating them with homeopathy. And this is an advantage that I had all the time because we had the colleagues working with us side by side to see how homeopathy works. So I don't think I ever had to stand and give them a lecture to find out whether homeopathy works. They have seen them by their own eyes in a day-to-day cases. And I think there are many orthopedic physicians who are now using Arnica, Ruta, and Symphytum in their day-to-day practice. And I think we should encourage that because that brings down the cost of treatment as well. They have learned specific indications for Arnica, Ruta, and Symphytum, and they precisely probably know better than many of us when to use those prescription and how. Now, this is exactly opposite. This is, this person was actually passing by the hospital and he had a vehicular accident and he was brought directly into the hospital post the trauma. Now, the contrast is the earlier case was 6 days old and this case was just outside your hospital. So you see the difference between the timeline is what I'm trying to focus. This person is walked in straight after the injury into the hospital. The earlier patient was at home for 6 days, the hematoma got infected, and hence they walked into the hospital. Now, this is what I'm trying to bring to your notice. Even this patient would receive Arnica, right? But not in the same potency. Not in the same potency. And the reason is how acute is the injury and what is happening to that tissue at this point of time. The capillaries are disrupted at this point of time. There is a tear in the tissue, and we are essentially trying to minimize the hematoma. In the earlier case, we were trying to dissolve the hematoma. In this case, we are essentially trying to minimize the hematoma. So in this case, and he had a fracture. He had medial 1/3 and lateral 2/3 right clavicular fracture and pain due to trauma. So obviously, the figure of 8 was given for realignment of the bone. And here again, objective of the treatment here is to stop the active bleeding and limit hematoma formation and control the pain, so that you don't have to use the antibiotics and the painkillers separately. If your remedy is able to achieve all these 3 things, stop the bleeding, bring the pain control, and limit the hematoma formation, you don't have to use serratiopeptidase separately against and then add an antibiotic to it and then give a painkiller. So you see, our remedies work 3 in 1. They don't need to be given separate things. And the secondary objective would be then to unite the bone and promote the callus formation. Right? So you divide your treatment into 2 parts. One, what do you want to do in the first phase? What do you want to do in the second phase? So how do we achieve the first phase first? It's very simple. There's nothing more bigger than this. What is the individualizing factor? The individualizing factor is the timeline from where he comes. Most of the people would talk about just pain. Hardly anybody who comes in after an acute injury is in a position to describe you any kind of pain. Right? Nobody describes you, I got a crawling pain, I got some sticking pain. They're so much horrified by the pain and the acute trauma that you will not get these kind of pains when they come. And I'm talking to you after probably I must have treated at least 1,000 trauma cases, which I know very well, that nobody comes with in an acute trauma. When they come to your casualty, nobody comes and tell you I have a sticking pain. They just say, doctor, I'm in pain. So be practical about it. our repertories talk about, pages and pages of different types of sensations in trauma. I would like to recall one small research project that I did with 675 or 700 patients of, for dental pain. And out of 600 to 700 patients, less than 20 could describe the pain other than just saying it's pain and throbbing. Right? And when I checked the rubric, our repertory is saying tooth, there are almost 20 pages dedicated to the chapter 2, out of which 18 pages are dedicated to sensations of tooth, of which 600 patients, more than out of 600 patients, hardly 20 could talk about this particular sensation. So I hope you understand there is a scope to debulk the repertory by actually understanding our repertory sizes can become manageable. They are actually expanding. I'm very sure that they will expand, and the more they expand, the more they become inaccessible to clinicians who have busy practice, who are practicing patients by 5 minutes interval. I'm sure many of you would agree that it is very difficult to keep repertorizing and going back to the repertories. Even though there are electronic repertories now, it's very difficult. So making our repertories more validated, bringing down their size, and providing precise data would probably help us rather than just expanding them. This is just a thought. I'm not again, I use repertories on a daily basis, all kinds of repertories I use. But when I studied, I understood that in practical situations, patients do not come up with all these sensations that we talk about. So here in this case, we directly started arnica with 1M and then went to 10M. So now you understand why I'm trying to say when do you use 30 and lower potencies and when do you use 1M and higher potencies. Within 3 days, the swelling had come down by 60%, and the hemostasis was achieved. So now we go to the secondary objective, and that is very, very simple. That is to unite and form a callus formation. And well, I think there is no big deal to understand that there are good remedies, and symphytum is a very good remedy for that. So I have not shared anything related to materia medica here. I think this is common knowledge to anybody from first year to fourth year. What I'm trying to drive home over here as a point is when do we use that remedy? Why did we start symphytum on day 1? Could be a question that should come to our mind. Why did we not, if arnica was helping, why did we not continue arnica till the end of the treatment? That could be another question that should come to us. So that's the point that I'm trying to say. So when you understand in trauma that your objective of the treatment is achieved, it's the time to use the complementary remedy. Like arnica follows symphytum is no new news for anybody. And an X-ray showed that there was a good callus formation within on the 12th day itself. Normally, in an adult, for a radiological callus to be seen, it takes around 3 to 4 weeks. Whereas in our case, we specifically repeated the X-ray because we wanted to see if symphytum is working. And on the 12th day itself, the callus formation was there. And once the callus formation is there, we just leave the patient alone, because the body is very much capable of remodeling its callus back into the normal. So on the 12th day itself, the entire treatment was over, and within 2 weeks we could strip him out of the figure of 8 as well. So I think this is something that we really need to understand. That had it been that he was only on anti-inflammatories and painkillers, and he would have probably gone, he would have healed. There's no doubt he would have healed, but that healing would have taken 3 to 4 weeks. With just prescribing 2 drugs, arnica and symphytum, at the right time, in right potency, you could cut down the course of the illness. He didn't have to take multiple drugs, and you bring down the cost of illness, as well as you can, instead of 3 to 4 weeks, you could bring it down to 2 to 3 weeks. You save 2 weeks of patients' immobilization. Now, what is symphytum? I think everybody knows. It has this astringent, mucilaginous, and gelatinous think that, and symphytum has been there. It's nothing to do with homeopathy. Symphytum has been used traditionally. Symphytum has been used by a lot of traditional healers even before homeopathy discovered it. So, the credit, we have just been using it in a potentized way, but in a crude form, this has been used for even before homeopathic prescriptions were made. So, it is known to have these action. It promotes the granulation in the bone tissue. It has specific action on periosteum and bone, and has, because of its astringent and mucilaginous properties, it is known to stimulate the what do you say, the callus formation in the bone. This is how your symphytum looks like. Now, this is again about a 70-year-old male patient who underwent a surgery for removal of foreign bodies from his knees. Okay, he underwent a laparoscopic surgery for that, and the main danger was he was on anticoagulants, and hence there was an issue that he might develop hemarthrosis. So the orthopedic surgeon approached us saying that I want you to make sure that his post-operative bleeding is controlled. Okay, he extracted the loose bodies out from the knee, and his only thing was to make sure that the post-operative bleeding is under control. Normally, he expected around 80 to 100 ml of bleeding to happen on the first day, which was not advisable for this particular gentleman because he was already on anticoagulant and we couldn't withdraw the anticoagulant for a long period. So there's no major thing here again. Decide when are you going to give arnica? Right? You are going to start arnica immediately after the orthopedic surgeon creates trauma inside his knee. So we started arnica as soon as he was out of the OT. We prescribed it 2 hourly at 1M 2 hourly, and we made sure you could see this. And the first day itself, the bleeding was less than 20 ml. The expected bleeding was 80 to 100 ml. With arnica 1M given, the bleeding got restricted to 20 ml. Within 72 hours, the drains were removed and the patient could be sent. Now, this is what happens when you are able to work side by side with an orthopedic surgeon and do a very specific job assigned to you with homeopathy. Now, what do we do about it? The second objective of the treatment was to heal the knee. And so basically we defined the entire case of that particular person, and it turned out to be that the person required calcarea flu as a remedy for the further things to heal. So, and if you look at these remedies, arnica and calcarea flu, they both are complementary to each other, and basically calcarea flu has action on the fibrous tissues, ligaments, and it has a prominent action on deposition wherever there is a calcium deposit. It is a remedy for when you want to heal by secondary intention. Okay. So this is precisely what we do in surgery, post-surgical cases, that we prescribe the arnica in a very high potency more frequently. Once the hemorrhage is taken care of, then go to the constitutional remedy or any other phase remedy that we use. The calcarea fluor was given in 30 potency 3 times a day, and over a period of time it was withdrawn as this thing happened. I'm not going to go into the drug. Basically, I think everybody knows about calcarea fluor and its action. So, what is the basis of all that I'm talking right now? It's mentioned in aphorism 63. Every agent that acts on vitality more or less deranges the vital force and causes for a longer or shorter period of certain alterations in the health of the individual. This is termed primary action. I'm reading to you aphorism 63. So be it trauma, be it injury, be it bites, be it burns, this is exactly what it does to the body. it sets in what we call as primary action. Although this primary action is conjoint product of medicinal and vital powers, it is principally due to former. That is, to this primary action, our vital force endeavors and apply energetic opposition, and this automatic life-preserving reaction goes on by the name of secondary action or counteraction. So what we are trying to understand here by understanding the timeline essentially is, where is your patient at this point? At what point of time you are intervening, so as to understand what is the state of vital force that he is in at this, what is the reaction of vital force that he is going at this point. During the primary action of morbific agent, which could be medicines, our healthy bodies and vital force, as will be seen by the following example, seem to behave in a passive or a receptive manner, as if compelled to receive the impressions from outside, acting on it and preventing itself. An exactly opposite condition, if such be possible, the counter effect proportionate to its own energy and intensity of primary action. Where there is no condition exactly opposite of primary action, the vital force appears to indifferentiate itself, and putting forth the superior strength, it extinguishes the morbid changes, thereby restoring the normal health. So it's all the game of understanding this aphorism 63, primary action and secondary action. I'm sure students probably by now have by-hearted it and passed it through. So there's no reason, if you feel there is no reason to go back, there is a reason to go back to the aphorism 63 and understand it in the practical perspective. There are great examples of primary action and secondary action mentioned in aphorism 65 as well. I'm not going to go into details of that. Let's go straight away to the case 5. Now here, this is patient presented with swelling on the left thigh and on the posterior aspect, which was 20 centimeter by 15 centimeter by 10 centimeter. It was a tender swelling and a warm swelling. So we did a sonography of the particular region and we found that there is a deep muscular abscess extending through the septum. So an incision and drainage was carried out because the swelling was like 15 centimeter by 20 by 10 centimeters. No way could you, absorb that kind of a thing. So an IND was done of the deep muscle wound. It was basically, when we opened up, we found out that there is a hamstring necrosis. Okay, and it had caused because of a blunt injury. So this is the amount of pus that was drained. And this is the post-operative wound. Okay. This is the pus. This is the post-operative wound. It is necrosis of the hamstring, which had caused an abscess. Now, what would happen if you don't, if you don't treat it well? It is likely that one, it will cause infection, very common. Not a problem. But the second thing is there will be a contracture of the hamstring leading to fixed flexion deformity. For the rest of the life, the patient will limp. For the rest of the life, the patient will limp and will not be able to walk because his hamstrings will never heal by primary intention and they will cause contractures. So this is where I think we have a good role to play. What is it that we are looking at? There was trauma followed by a large abscess in the hamstring, which was 10 by 20 by 15 centimeters, which is already drained. And you should go and watch your surgeon when he is actually draining the abscess. They nicked it, and then he was actually, with what we call as a finger dissection, he was actually removing each septa of the hamstring with a hand. So he was tearing each piece of the hamstring inside and bringing it out till the entire abscess drained out. Why it is important for us to watch this is to understand, because our materia medica goes down to that particular level. So when you have lacerated injuries to the tissue, okay, followed by pus formation, and post-pus formation wanting to have healthy granulation tissue, right? This is exactly what calendula is all about. Lacerated wound, unless you go and see how your surgeon is operating. He did not operate with a knife. He was actually doing a finger dissection to preserve every string of hamstring that was possible. His idea was, the more I preserve, the more I'll be able to give him a full healthier flexion and extension of the. So he didn't want the fixed flexion deformity to happen, and that's what he challenged me. He said, if you can get him out of the fixed flexion deformity, I'll be happy. Because I don't know, I have no scope to prevent that. I have done my job, I have dissected it, I have brought out the pus, but I have no. I said, then don't give him antibiotics. Don't give him antibiotics, leave it to us, and we'll try and do what we can do. With great reluctance, we convinced him. Mind you, this was the size of the injury. There are medical legal concerns. You can understand not giving antibiotic after draining this much of pus. You know, anybody can pull you out in a medical legal suit. But we had worked together for 5-7 years, so he knew what we were doing. He said, okay, let's see day by day. I will do the dressing of the wound at any point of time. If I find that the patient has infection, then you should allow me to give antibiotics and allow me to start it. I said, we'll do that. Let's try it out. So this is on day 2. This is day 5. Day 7. You can see that there is no infection coming up at all. And the wound is closing up. And there is, you can see this red meat. That's exactly what every surgeon would like to see. The nice red meat that is coming out. This tells us that we are on a right track. The healthy granulation is coming up. And there are dates on each of these pictures, if you see. So this is absolutely timelined evidence that we could generate. And this is the final recovery that happened after the. Thank you, sir. But I thank you very much for this. But what I would like to suggest is this is doable. This is doable, and this is something that we all should try and do, provided we know what we are doing. What is the potency that I'm going to use calendula for in this particular? What is the dose? How long am I going to use? We did not use a local application of calendula, whereas we are commonly inclined to use local application of calendula. We only give it per oral. And what we did here is, I told him that we had to keep the wound moist. So what we would do is, we did an open irrigation. What is open irrigation? Is just put a gauze inside the wound and keep it moist by giving a normal saline drip over the gauze. So why do we do that? Is our calendula not sufficient enough to heal everything? It is. But if you are going to cause obstacles to its healing, then there is a problem. If you don't keep the wound irrigated, right, the granulation suffers, the infection grows. So there is a concept called obstacle to healing, right? So and there is a concept called using ancillary measures. You're just using what? Just normal saline, irrigating the gauze and keeping it moist. You're not medicating it. Right? We have used what we call sterilized banana leaves to heal burns, along with cantharis, right? No local application of cantharis. Cantharis is applied when there is 94% volume by volume alcohol. You are macerating the wound. You are actually charring it. You are actually damaging it more than, so use it per oral. Don't try to use it locally in cases of burns and open wounds. There is a normal practice. Even I would do that some time ago. Even, it's a normal practice to apply calendula and cantharis on the wound. If your wound is dried up, if it is superficial, then using a liniment, using an oil-based local application is fine. But if you have a raw wound, just keep it moist dress it so that it doesn't cause infection. Keep it hygienic. Your sterile should be hygienic. Your sterile gauze should be absolutely hygienically maintained. You should be wearing the gloves when you are doing the dressing, and keep it moistened all the time. The more it dries up, the more scab will get formed and the more chances that you will accumulate infection. So these are some of the ancillary measures that are very important. They can be done on an OPD basis as well. And that's why I'm saying we did not use calendula locally at all. We were just giving him orally and in multiple doses till what you saw happen. Why calendula? I think there is enough, understanding of calendula in these textbooks. Bird, Kent, Clark gives you enough understanding of why to use calendula and in what potency. Whenever you are using now, what do you think I would have used here? What could be the potency? It's trauma followed by, so it's a blunt trauma leading to necrosis of the tissue, causing a large abscess, dissected with the, without a knife, and there is an immediate open injury. Should I use a high potency? Should I use a low potency? I think now the concept is getting through. So you understand what I'm trying to say. Don't use a high potency when you have a well-formed illness with no characteristics. So this is a case of snake bite, which we treated with Hecla lava. I don't think that we should go into this. The more important is, let's look at this particular case. So this person had he met an accident outside somewhere in the hospital, and he was treated by some orthopedic surgeon who was not associated with our hospital, and the wound had gaped. It had been secondarily infected, as you can see here. All this white stuff that you see is infection. There is a calcaneal fracture. The calcaneum was completely crushed. Three of the metatarsals were fractured and displaced. Patient had fever. There was dirty slough. The tissue was absolutely friable. If you touch it, it would just peel off. And you see there is a degloving thing. The entire skin and the fascia is gone. So what do you do with this kind of trauma? This is how it looked when it arrived at our in the hospital. So we went and found out what is the patient suffering from in terms of symptoms. Only 3 symptoms he said. There is slough in the wound, which we could observe, everybody could observe. The wound was secondarily infected. There was severe pain in the night, which was better by cold application. So night aggravation was there, better by cold application. And injury which had ulcerated and which had lot of slough. I don't think we need to really talk great about the remedy. We chose Merksol to treat this particular. And I will just show you what Merksol could do. This is now the healing process. You can see the difference between first wound and the second wound. This is before Merksol. These are after Merksol pictures. So why did we choose Merksol? We took a full case of that particular person, and we realized when we took that particular case that overall personality was more like calcarea carb. So if calcarea carb is your personality, right? What is an acute remedy that would come up which has ulcers, slough, and a night aggravation? Very simple. So पहले कुंडली बनाने का, फिर उसके आजू बाजू के ग्रह ढूंढने के. तो कुंडली कैल्केरिया कार्ब की अगर कुंडली बनती है तो उसके आजू बाजू में हिपासल्फ या मर्कसॉल कहीं ना कहीं घूमता रहेगा, तो उसको पिकअप करो. उसके लिए वो कैरेक्टरिस्टिक सिम्टम ढूंढो which रेफरेंस टू बोनिगसन्स के कॉन्कॉर्डेंसेस चैप्टर में जाके इसको देखिए. These are chapters which are well forgotten. I think people who have done MD also may not now remember. Concordances chapter in Boningason gives all these details. Okay. So if you find out that you don't have to really read a lot of material, you should know what smart working is more important than hard working. This is what I particularly feel. You know where to choose, where is this information lying, who has written this information, where to pick it up from. Okay. So कैलकेरिया काब अगर कुंडली में लिखा है तो उसके आजू बाजू में के जो ग्रह घूमेंगे उसमें बेलाडोना होगा, मर्कसॉल होगा, उसमें इपारसल्फ होगा, उसमें बढ़ियागा होगा, राइट, रस्टॉक्स होगा. तो ये केस में क्या आ सकता है? नाइट एग्रेवेशन है, स्लफ है, डर्टी लुकिंग वुंड है एंड अल्सरेशन है. तो सिंपल सी चीज है, मर्कसॉल देना इजी है. ये टोटलिटी है. कुछ to form a totality and individualize, you don't have to do some rocket science. This is what I'm trying to say. Just apply your common sense and apply your mind properly. Go by the rules and regulations of homeopathy and you will be able to see this. Can you see the difference in the healing now? You can see that there is red meat actually coming out. We just continued Merksol 3 times a day, did a local dressing, no antibiotics were required. Can you see that even the arc which was destroyed has come back? The metatarsal, the arc has come back, the calcaneum has healed, the metatarsals have healed. This is the final picture. Why I am trying to bring this is in a conventional treatment, this would go in for a surgery, a remodeling and a plastic surgery. We treated this patient for 21 to 30 days. Okay. And this is something which there's no comparison of the cost that we save by using homeopathy. Even if you admit the patient and treat him on a daily basis, your cost of treatment will be 1/3 that of what a plastic surgeon would charge. And I'm sure that there will be more than 2 sittings to achieve the result that we were trying to get. So the whole idea that I'm trying to drive home, I'm sure there are a lot of senior people, they are practicing homeopathy even before I was born probably. So there's nothing more that I'm going to add to your knowledge. All I'm trying to say is that homeopathy is, I say it is a KISS principle, KISS. Keep it simple and stupid. Should look stupid when you practice homeopathy. अरे ये तो ओ गॉड इतना सिंपल है क्या? इतना ही सिंपल है. और कहीं पे भी आपको 2 दवा यूज करने की जरूरत नहीं पड़ती है, कहीं पे भी 4 दवा यूज करने की जरूरत है. If you know exactly what you are doing. Aphorism 3 is actually the most important thing that you should know. For aphorism 3, you should know your knowledge of medicine, your knowledge of organon, and your knowledge of pharmacy. A lot of people don't focus on pharmacy. They don't understand what are the active principles of these trauma remedies. And that is why वो pharmacy 100 मार्क का जिस दिन खत्म हो जाता है, उस दिन से लोग भूल जाते हैं. ऐसा मत कीजिए. Words पढ़िए. There are a lot of books which tell you about these active principles and the primary and the secondary actions of these remedies, and which will be particularly useful to you when you are treating non-miasmatic diseases. Diseases which have causes externally, outside your own schema. I think this is another case, but more important, we'll take up some. This was a laborer who fell down from a truck from a 10 feet height and fell on his neck. Okay. And he was unconscious for 2 hours and was lying, was not able to move. So he was quadriplegic below his. He was completely quadriplegic, was not able to move upper limbs, both the upper limbs, not able to move both the lower limbs as well. And we found that his lower limb power was 0. So he was completely quadriplegic, no sensations, all deep reflexes were absent. The entire tone of the muscle was flaccid. It was just that he was able to breathe and he was able to use the upper part of his body well. So he had a cervical cord compression with a traumatic quadriplegia. An X-ray of the cervical spine showed C4, C5, C6 and C7 fracture and dislocation. This is the patient. I'm not sure if you can see it from there, but three vertebrae C4, C5, C6 and C7 are compressed and dislocated. So when you go about the spinal cord, again, we have to know what is the tissue that you are treating and what is it that you can expect from this thing. So you really have to know when and what is the level at which the injury has happened, and what would be the impact of having such an injury in terms of, and when has the patient come to you, whether there is a spinal shock, whether there is a spinal contusion, whether there is a spinal hematoma. All these things is something that you really need to know. I'm just trying to give you the pictures which can help you understand, revise this. So you need to know this entire gamut of knowledge before you start treating this kind of cases. Sorry. So what is the management protocol for spinal injuries? First is managing the acute phase, which includes hemodynamic monitoring. First thing is stabilize the hemodynamics of the particular patient. Okay, maintain the blood pressure, which is very, very important. Bladder and bowel care is important because usually they have both paralysis. Bladder and bowel are paralyzed. Then there is a physiotherapy rehabilitation. Commonly, modern medicine will prescribe methylprednisolone to reduce the spinal cord edema, and cervical traction to reduce the compression, which can lead to further edema. This is the overall broad management protocol for spinal injuries in modern medicine. So this external fixation is what we did for this particular patient. So I'll show you the picture of that. You can see there is a tongue fixed to his skull, and that skull is being pulled on one side and his body is pulling it on the other side. So that is exactly what we did to immobilize as well as realign his spine. So you can see that big tower in between that is holding his neck with a tongue, and his body weight itself is countering the weight of the skull. There you see. The tongue is fixed in the occipital region of the head. Is it required? Yes, it is required, because your remedies do not have the ability to mechanically fix a deformity. Homeopathic remedies do not have the ability to mechanically fix. This is the mechanical disruption which needs just a realignment. Realignment is not healing. Realignment is a part of healing which allows you to help aid the process of healing and removes the obstacle to cure. So this is the way the tongues were fixed, and you can see after the tongue, the alignment was there. This is not due to homeopathy. Please understand. Don't overcredit ourselves. This alignment is not because of homeopathy. This is because of mechanical fixing done by the orthopedic surgeon. Now, whether it helps, we'll have to see. Now, what happened is that within 24 hours, he started getting some reflexes. So, which indicated that that particular alignment had helped. Okay, but there was no further progress. And the orthopedic surgeon had given the course of methylprednisolone to him, which did not bring about any change. And that is where, after 10 days also, he says that if it doesn't change after this 10th day or 12th day, then he is likely to remain quadriplegic for the rest of his life. Now, this is where, when do you involve homeopath? When everything is almost about to get over. That is when homeopathic doctors are called. Right? And I believe that is a blessing in disguise, because then we have nothing to lose. If at all we have to gain. Right? Don't feel bad about it. We will gradually gain into that, where you will be the first responder. But today we are not. That's fine. That's fair. But let's inch by inch prove ourselves and say that we can do something, we can add something better. So he says that there is this whole thing will not, the moment he removes the tongue, he will go back to the the original thing. So what is to be done? We observed the patient in the ward and we took his certain details. You can see by this thing, he is a laborer. He has no orientation to homeopathy. He doesn't know what is homeopathic characteristic. I asked him, somebody asked what is a craving. He said, "Sab, 2 वक्त का खाना मिल जाएगा तो ठीक है." So craving was a fancy question for him. You understand what I am trying to say? 2 वक्त का खाना मिलेगा तो ठीक है साहब. Cravings and aversions तो दूर की बात है. Do you require AC लगता क्या पूछने का सवाल नहीं है, right? गर्म पानी से नहाते क्या? वो बोले सर नहाने को पानी मिला तो नहाते. This is the state of homeopathic characteristic. Can we? Because I myself teach. I used to teach, and we talk about a lot of characteristic. This thing, our repertories are full of characteristic. A patient आके बोलता है साहब नहाने को पानी मिला तो नहाते, खाने को खाना मिला तो खाते, right? Craving aversions कुछ है ही नहीं. फैन के नीचे सोए क्या, AC के नीचे सोए क्या, कुछ फर्क नहीं. कंबल है ही नहीं. अब इसको होम्योपैथी देना, ये चैलेंजेस. तो जो हम क्लासरूम में पढ़ते हैं वो अच्छा है, लेकिन जो फील्ड में करते हैं वो ज्यादा इम्पोर्टेंट. तो इसको कैसे होम्योपैथी देंगे? तो उससे बात किया तो वो ही वॉज वेरी रेस्टलेस इन हिज माइंड एंड ही सेड कि ये निकालो. निकाल के क्या करेंगे पूछा, तो बोलता है काम पे जाना है. एक उंगली भी नहीं हिल रहा है और बंदा बोल रहा है मेरे को काम पे जाना. और बीवी के साथ पूरा जितना 10 दिन था, डे इन एंड डे आउट ही वाज अब्यूजिंग हिज वाइफ. मतलब इरिटेशन हो गया था. आई कैन अंडरस्टैंड. आई एम नॉट ट्राइंग टू से being judgmental about it, but his behavior was, he was extremely irritated, very arrogant towards his wife, using her and constantly telling the doctor, I want to go and work. बस इतना ही केस. चिली है कि वार्म है कि हॉट है कि क्या है, क्रेविंग्स एवर्जन्स का कोई स्कोप नहीं है इसमें. तो वी अंडरस्टूड कि वो छोड़ने को तैयार नहीं है. उसको ऑर्थोपेडिक सर्जन ने बोल दिया था कि भैया तू अभी हिलेगा नहीं, तेरे ब्लैडर में एक कैथेटर रहेगा और तेरे को बॉवेल के लिए पॉट देना पड़ेगा, और वो भी कब होगा क्या होगा मालूम नहीं है. उसके बाद भी उसका स्पिरिट ऐसा था कि मेरे को निकाल दो, मैं जाता हूँ. You understood what I'm trying to say? Just remove this and I'll work. I know I can work. So he was at a totally different. His mental state was absolutely at a different level from what his physical state was. His spirits were indomitable. By now, if somebody tells me that you can't control your bladder and bowel, I think hardly even be depressed. We can't move our limbs. I don't know. That's a sin. God forbid, nobody should have that kind of a feeling. Short-tempered, excitable, very industrious, and thermally थोड़ा बहुत उसको इधर उधर से पूछ के मालूम पड़ा कि उसको he was more towards warm, but the strong desire to work and hardships were there with this particular. What we gave is we gave a calcaraflor 200 single dose. Now mind you, we didn't prescribe in multiple doses here because the case is already settled. The acute trauma is gone. We are now managing the complication and consequences of the trauma. That is why I am saying we saw the first case which came after 7th day. We saw the second case which came within 15 minutes of getting a trauma, right? And now we are seeing a case which is on the 10th or 12th day of seeing the trauma. So on 10th we gave this medicine. On 11th, patient could lift up upper limb actively for 5 to 10 seconds. Within 24 hours, we could see that patient could lift his upper limb, which was quadriplegic for last 10 days and had not responded to mechanical adjustments as well as to prednisolone. And we could see that there were flicker contractions in his deltoid and biceps. He could shrug the shoulders, so he had developed power in his scapula. And now you can see his power was 0/5 when he was admitted. And you can see that his power is now 3/5. And he could keep both his limbs flexed, which were completely extended, and he was almost in the... To me, this picture is very important. His hand reaching his neck. You understand what I'm trying to say? He could shrug his shoulders, his hand could reach his neck, he could keep his limbs flexed at power of 3/5 or 4/5. Now there were hopes that he could not only survive, but move on and go ahead. We treated him almost, you understand, I tried to explain this through the graph. On the day one, before the reduction was done and the tongs were put, there were absolutely zero power. With dexamethasone, he had slight improvement. And with calcarea floor from 0/5 or 1/5, his powers moved to 4/5 or 3/5. Why I'm saying this is, it is very important for us to understand that as a homeopath, at what stage of illness you are treating this particular patient becomes more relevant and more practical. Calcarea floor sab dhund lenge. If not calcarea floor, thoda idhar udhar jaake fir calcarea floor pe aa jayenge. But why do we use a single dose in this particular patient against 1M or 10M in another patient becomes very, very relevant. This is the last case that I would like to bring. This is a trauma caused because of bursting of the cracker in the hand. You can see that the child has lost all the 4 metacarpals. The distal metacarpals are lost. And there is burns. There are burns and there is loss of metatarsal. So there is amputation. Amputation has already happened. The wound is infected and it is a burn injury. हाथ में फटाका लगाते हैं ना, वैसे फटाका लगा रहते हैं और फट गया. X-ray showed loss of tips of distal phalanx of all the fingers and a 2nd degree burn. How old is the child? Child was around, I think, 14, 15, something like that. 16-year-old child, a girl child with losing fingers, fingertips at 16-year-old, coming from a poor socio-economic background. ये सब करके आए वो लोग. Debridement हो गया, IV antibiotics हो गया, everything was done. So this is how they approached us. I'm not sure if you are able to see this well. Only the thumb metacarpal is there. All other distal phalanxes have gone. So ailment from burns, okay. Convalescence of burn. It is there in cross reference, convalescence burns. So don't go for, there are two rubrics for burns. One is acute burns and one is convalescence of burns. Okay. What is happening? The tissue, there is destruction of tissue and the wound soft tissues with tone. Now you see this is where repertory comes into picture. Convalescence of burns with wounds, soft tissues which are torn, ulcers which are contaminated, and burns which ulcerate. This is in Robin Murphy. Burns which ulcerate. Commonly burns बोले तो क्या था? Cantheris, Epis, correct? No? और क्या था? Cantheris आता, Epis आता, और कौन सा आता? Causticum आता, Merxol आता. Correct? This patient received carbolic acid. And why we would not give? This is the rubric. This is the rubric, 3 remedies that you should differentiate. Merxol is also there in convalescence of burns, but it is infective. Okay. Causticum is a contracture post convalescence of burns. Causticum is contractures post convalescence of burn. Carbolic acid is burns with loss of tissue and infection. So if there is loss of tissue, then think about carbolic acid. If there is just infection post burns, Merxol. If there is a contracture post burns, caustic. And These remedies you will get in these 3 rubrics itself. So even though I said a little bit about repertory, there are very classic rubrics sometimes which can be useful. You should know which repertory to use at what particular. So I used one synthesis and the last one in Robin Murphy. ये rubric है, ये मालूम होना तब आप वो rubric लेते हैं. What your mind, your mind has to know. Repertory is a tool after all. You put in garbage, it throws out garbage to you. So who puts in garbage? It is you who put in garbage, and then you blame the repertory. We always say, कुछ भी डाला तो sulfur आता ही है. Right? 6 remedies is sulfur, arsenic, phosphorus, lycopodium. You throw any garbage into that repertory, they will throw it out. So repertorization is not about making a long list of symptoms. Repertorization is all about picking those 2 or 3 key symptoms and putting them in an order which will give you that right. So this is how we differentiated carbolic acid, and read carbolic acid. And never make a decision based only on repertory. Go back to Materia Medica and read. Burns which tend to ulcerate. And it's a powerful antiseptic. Carbolic acid is a powerful antiseptic. Burning sensation and burns which tend to ulcerate, which is very specifically mentioned in deep burns and their effects. Deep burns and their effects. Let us see what happened with carbolic acid. Can you see that the distal phalanx which was not there is now visible? You never expect a nail to be back. This is the beauty of homeopathy. Even a plastic surgeon cannot bring back the nail. She required at least 3 sittings of constructive surgeries. And mind you, the impact of giving back 3 fingers to a young girl who is 16 and maybe will get married in another 5-7 years, I think that impact is something that you cannot measure in money. Right? And the cost of the treatment with this kind of work, believe me, is immeasurable. I mean, you just cannot compare that with any. If a homeopath stands with a plastic surgeon or with an orthopedic surgeon and delivers, I'm sure the cost of treatment would come down at least by 1/3 to half. Length of stay comes down by almost half. The moment length of stay in the hospital comes down by half, the cost of treatment gets reduced at least by 1/3 to more than half. That is why I have been with hospitals for a long time, and it gives me immense pleasure to treat such cases, because we can deliver something which most of the time an average orthopedic surgeon or even a superior orthopedic surgeon will not be able to deliver these kind of results. With nails coming back, it's highly impossible that tissue would have been regenerated out of a completely destroyed and a burned tissue. Later on, we gave her a single dose of calcareous phos 30 on a weekly basis to rehabilitate this entire. Now, what we could do is we avoided reconstruction and remodeling surgeries. We avoided a skin graft. The cost of the treatment was 300 to 400 rupees, which is, something that everybody can achieve. And out of treating such and similar cases, I was able to formulate this particular table, which allows you to think. This table is for thinking. When you think, how do I individualize this patient? You don't have to give arnica and calendula mix. Don't do that. It's not required. You should know when to use arnica, how to use arnica, at what time to use. And you should have a complete knowledge of how a human body heals from a trauma. What are the phases of healing of a human body? And how to assess a wound from clinical perspective and how to assess a wound from homeopathic perspective. Remember time scale and remedies. The more you are towards the 0, right, from the time of injury, the more you would require an acute remedy to be given. The more you move from 0 to N, this will fall down. This will start becoming flatter, and this will move. The more you require, the more early the patient reports to you, more likely that you will need to use an acute remedy. This is first rule of thumb that you should understand. The more at the earliest, if he reports to you, you will require highest potency. So as you go away from this 0, the potency starts becoming lower and lower. And the third most important thing, the more acute the injury, the more early he reports to you, you should prescribe in high potency and in frequent repetition, because that is the time you are trying to prevent the damage. The more later he comes to you when the damage is already done and the pathology is already formed, then you go more towards the chronic management style. Right? And remember, I read the aphorism what Hahnemann says, treat injury as if you are treating an acute disease. So all of our cases basically are non-miasmatic surgical diseases, which is very detailed understanding is given in aphorism 186 up to 194. All cases summarized here have a definite causation of trauma, operative or accidental. Type of trauma and nature of injury is very, very important for you to understand. Whether it is a contusion, crush injury, sharp injury is very, very important for you to understand. When you select the remedies, look at the tissue affinity of that particular remedy. Look at the tissue affinity of that particular remedy and read the primary and secondary drug action which is mentioned in the pharmacy books and not in our regular materia medica books. Okay. Find out the duration and effect of the injury. What is that injury leading to and what is the duration? I showed you those graphs. The more you are towards the 0, the more acute, the more frequent, and the later, the farther you go away from the 0 towards end, less acute remedies, less frequent remedies, less lower the potency and less frequency. Also, there is a general and a specific response of individual or the constitution to injuries, which is mentioned in our aphorism 186. So our body and the mind reacts to the injury, and that is where you define your case. What is the reaction of our body and mind to the injury? Important to break up your objectives. When you are treating trauma, break down your objectives. What is my first objective? Stopping the blood is my first objective. So what is the second objective? Preventing contamination and infection is the second objective. Third, maybe trying to heal by primary intention. If not possible, heal it by secondary intention. Create fibrosis, which will allow the tissue to get healed. And please focus on ancillary measures aphorism 289 to 291. That talks all about how do we keep the wounds hygienic, how do we maintain the hygiene in a wound, and how do we take care of like giving a splint or giving a tongue that is required for bringing about alignment, giving a figure of 8, or maybe putting a plaster cast for doing the. And more important, periodic follow-ups is very, very essential. Don't give a remedy and forget the patient. Okay, many of us have this habit of giving the remedy and forgetting the patients. Don't do that. You need a very close and a periodic follow-up in order to take care of the remedies that need to be given sequentially. You might need to give arnica to symphytum, but you have to know when. that when is more important, not which remedy. Everybody knows the remedy. What is more important is when to shift from arnica to sulfite, when to shift from calendula to others. And I am very, very clear, you still have to do individualization, use the principle of individualization, even when you are treating a non-miasmatic surgical case. So there is no running away from principle of individualization. There is a role of constitutional medicine after healing or during rehabilitation. If your patient is in the rehabilitation or remodeling phase, you have to use a constitutional medicine, because rehabilitation and remodeling is not just at the local tissue. Your mind, body, and your entire tissues have to get adapted to the new normal after the injury. Right? Hence, using the constitutional remedy to align your mind and body to the new tissue, align your mind and body to the new deformity, align your mind and body to the new, circumstances that have created is very, very important. Rehabilitation, physical rehabilitation is absolutely required. Physiotherapy, yoga, whatever is required for healing the tissue at that point of time should be advised. And more important, if you do not give constitutional remedies, there are certain traumas which will leave a so-called dent in yourself, in the person, which is in our repertories or in our concept in aphorism is written like not well since the trauma. So he will carry some lingering issue, he will carry some chronic pain if you don't give him a constitutional remedy at the end of the treatment. That is why you see, even with the carbolic acid, the entire wound has healed, but we prescribe calcarea phos as a constitutional. We prescribe calcarea fluor to that person who was having a trauma in the neck. Right? So it's important that you give a constitutional remedy at the end of the treatment to close the management of that particular patient, so that the patient does not have any chronic, not well since phenomena. So I think I have done, I've taken enough time. It's exactly 1 hour from what we started. I thank the people and the HMAT and all our office bearers and the senior doctors who have been here from the state of city of Hyderabad. Thank you for your patient hearing. I hope I have, I'm sure I have not given you new remedies or something new, but I have given you the practical understanding of how in the clinics or in the hospital you can use these remedies, and specifically potencies and reputations to bring about this particular kind. Thank you very much. I think it was a bit of an odd topic, but I hope it helps everybody to take your practice and contribute to the growth of homeopathy. Thank you very much.
the presentations today that you can imagine that homeopathy has come of age. How often have we heard about flavonoids and their application in homeopathic medicine? How often have we seen about the antioxidant action of arnica? How often have we understood that when there is a serous oozing and that has to be cleared up quickly, it has to be arnica? And how often have we really known that mucinous production of symphytum actually brings out the callus formation? This is exactly what the homeopathy of the future would be. Thank you so much, sir. It is how the pathophysiology is initiated into action, irrespective of the fact that we cannot find the homeopathic principle or the finest particle of homeopathic medicine through our applications of physics or chemistry or energy of the world today. The fact of the matter is that there is a pathophysiological action, and this is how we explain it in the days to come. Any other homeopath probably would have rushed to the mental symptoms, especially when you have heard about the case of the gentleman who was having a disc injury and saying that I want to go to work and have an constant state of irritability with his spouse. So, but that would have landed us in a different soup and the patient being immobile for life. But it is only because thinking out of the box, thinking more easily, more swiftly, and more differently, and it's not stupidly as Dr. Pawaskar says, but it is very sweetly and very surely, I would like to believe that homeopathic medicines work better. Indeed, sir, it's a time to move on. It's a time to move on for the application of homeopathic remedies. And it's a time to move on the way these are explained. And this is, I'm sure, going to be the beginning of many more to come. And I'm sure a lot of people will take inspiration the way you have presented this. It is also a good reminder for us to not to stick to one remedy. Saying arnica has done the job, okay, I'm sure this is the only remedy for you. You are born to take only this remedy. No, it's a time to move on. When it is the acute phase, it is something else. And when it is into the chronic phase, and to see that there are some changes which don't remain irreversible, we have to look at some remedy in the later part of the prescription. It is also a great exposition of the potencies. I'm sure there is a lot of confusion amongst everyone, irrespective of experience in homeopathic practice, that we don't understand when to prescribe which potency. And this is one of the best examples of when the better potencies have to be prescribed. When the patient is right in front of you with a 6-day-old injury and hematoma, why rush for something big? You have talked about arnica in lower potencies. And the patient who has reached you right away across the road having an injury, you have spoken about a remedy that has to be given in a higher potency. Indeed, sir, it was one of the best things that has happened in recent times. And this is not the first time we have heard you. We have heard you speak about pediatrics earlier, and it is equally interesting and fascinating. And I'm sure homeopathy may have lost a good practitioner if you have joined an institution. I'm sure you would be practicing there also, but you would be busy doing so many other things. But the way it has to be explained through clinical parlance, you have brought out a great picture. This augurs well for the future of homeopathy. Thank you so much, sir. And we thank the organizers of this oration, Srimati Dhage family, for having given us this opportunity to present this oration every year. We feel proud that we have been able to do this for 25 years. And I'm sure in the days to come, with the young energy that is here around and the blessings of senior practitioners like Dr. Amarender, Dr. Navin Reddy, Dr. C.V. Swami and others, that there will be great inspiration to go ahead. Thank you so much, sir. To Dr. Vashish, sir, for running in, though maybe late, but holding the fort for us as our president, Dr. Gopal Krishna is out of town, and taking care of this oration this evening. And our lone warrior, Dr. Durga Prasad, sir, who is part of everything that he does, and good practitioners like Dr. Madhuvan, Dr. Pagadala, and Dr. Satish Krishna for having come here. And I would also remind all the youngsters here that this is the reason why I've been coming to this association for the past 22 years, to learn snippets of wisdom from people who practice and in real life give this to all of us. Thank you one and all, and we can all speak out standing up for our national anthem. Jana Gana Mana Adhinayaka Jaya He Bharata Bhavya Vidhana Punjab Sindh Gujarat Maratha Indya Himachal Yamuna Ganga Uttara Tava Shubha Name Gane Tava Shubha Shishma Ahe Tava Jaya Jana Gana Mangala Dayaka Jaya He Jaya Jaya